Hello, American people. I'm extremely concerned about this coronavirus and the impact or the potential it has to have a serious impact and pandemic and damage to the American people and the economy. And I'll explain why. I'm saying this only because I followed the virus from day one, from the actual breakdown of the virus to what the virus composes of, everything. Obviously, because of the threat it poses to the elderly and everybody else. So I followed it in quite good length, and it's something I've always had an interest in viruses and virology. But also following the economy and following what's going on and knowing how our stock markets work. And they're all the be-all and end-all of our governments, because basically that's all the GDP works on. It's financialized. They financialize the markets, and they don't even reflect the real economy anymore. So it's the most fragile thing. I think also possibly the reason why governments wouldn't, I suspect, my personal opinion is they wouldn't be too transparent in this, because fear of losing any points on the stock market, and God forbid a few people might lose $1 million here or there. But where my real concerns lie is your healthcare system, because the banks and the top 3% have pushed all their investment and funding and stocks, everyone's money, the biggest investment in money these days, and the one that the industry that exceeds the stock market, financial sector in profits at the moment, is pharmaceuticals. So vaccinations, gene editing, bioengineering, and the medical industry is where all the banks and the 3% are putting all their money and their stocks. So, as usual, greed, once they've holidayed with something else out, they decided to go into the healthcare sector. The aging baby boomers, social care is where they're all targeting, trying to make as much profit as possible. This is why you've got Bernie Sanders pushing for Medicare for oil. But if you look at the statistics, how many Americans, depending on their income, can afford proper healthcare, because yours is completely privatized. So you've got to pay ridiculous premiums. It's just everyone's got a toe in. It's purely your entire financial or your healthcare system is set up purely for profit, to extract profit. It's a massive money-making business, and everyone's happy, and no one's going to complain. And that's why Bernie Sanders has so much resistance, because there's so many people profiting from this business, whether it's insurance companies, healthcare, doctors, medicines, pharmaceutical. So they do not want their profit business taken away. But this is where, in privatizing healthcare, we have now put profit above patients' health, patients' safety, patients' well-being. And my concern is looking at your statistics. I've been following this with your elections, because I love Americans, some of the most wonderful people I've had the privilege of working with or getting to know. So I wouldn't hate to see any harm come to them. But I fear this will. Reason why, lately some concerning things have come out. The fact that people that have been tested have been lambered with big bills. It's not cheap to get tested. Secondly, people now that do test positive have been, obviously have to go into quarantine, and then I'm getting sent a huge big bill, thousands they've got to now pay for this so-called quarantine, which is, you haven't really got a choice. If you're sick, you have to go into quarantine, and you're now forced to pay this. Secondly, the supposed virus, which is, this vaccine is huge money-making business. There's about 20 or more companies pushing to push out the vaccine so they can get the first in the market and get their money's profit. Supposed figure I've heard for now is $3,000 odd for this coronavirus vaccine. Now, in all these circumstances, looking at the finance, I'm afraid at the moment, so few people in America, 50% at least, are living from paycheck to paycheck. People don't have an extra $600, extra $3,000 for any of these things. The people that are unemployed are going to be in serious danger. Now, if you look at the hospital closures and in the poor areas, because there's no money in it, most of the shareholders in these hospitals and these big companies, there's very few companies that actually own most of these hospitals. So they're normally syndicates. It's a whole group. Hospital group is owned by a particular corporation, and those very few have shares in that. So they've closed down. So where you find people have a lower health care, I don't know how your system works, insurance package, it's not profitable. So a lot of these poor areas, they've closed down hospitals, closed down these. So the best care and the best treatment and the best facilities are in the wealthy areas, because those people have the best insurance, so they'll pay more, so they make more profit. So this is where, in a case where you've got a pandemic or something like this, which is quite contagious, all your poor areas and people that haven't got anyhow, that can't afford it, first of all, are going to die because they cannot afford the treatment or health care. And it's going to disencourage because people know they're going to be in debt. So it's going to have an impact on your economy. The reason why your stock market is fluctuating, because they're well aware of this. People in the stock market and the actual business people, they're well aware of it. Because if enough of you get sick and end up with these huge bills, you're going to default on your rent agreements. You're going to default. You won't be able to pay on your bills because so many people are living from paycheck to paycheck. They're not going to have, on a mass scale, if enough people get ill, they're not going to be able to afford these hospital bills and the vaccine costs and things like that. It's going to indebt people, and people are going to avoid, until they're really ill, coming forward for a test if they suspect, or they'll try and brush it off because they cannot afford to pay for the treatment, for the test, for the quarantine, or any of these. So this is my concern, the greed and the danger of completely privatizing and running a healthcare system on pure profit and stock pricing. In a situation where this pandemic is massive spread and loss, and this can really cause a huge, this is my personal opinion, all the facts are out there, statistics are out there, that's common sense, that it's going to encourage people not to seek treatment, not to come forward if they're ill. And so it can cause a widespread pandemic, and it can encourage our governments also not to be transparent about how many people are being tested, keeping figures and facts from us, because they do not want that stock market collapsed, because they've already hollowed it out. They've been propping up forever. The collapse is imminent. So they're trying to hoard off panic and fear or stock sell-offs. They don't want to lose. Most of the stock prices are way overvalued. So they've been pumping it up. They don't want to lose that extra bit of billions they might have. It's not. So I think they'll be also trying to play it down to protect the stock market purely for that same reasons. So my concern is this for all those reasons. Very concerning. People, take care. Bye.